Okay, today we're going to talk about to sippy cup or not to. There are many pitfalls with sippy cups, and I know, I get it. I'm a parent too, so I've raised little ones. I know they run around. Cup drinking gets messy, but we're going to talk a little bit about why it's a good investment in your child's development of speech and their feeding skills to try and get rid of the sippy cups as soon as possible. Definitely by 12 months of age, bottle drinking should be going away, and preferably sippy cups. I know parents usually cringe a little at that because we're so busy these days. Parents are, running with their kids. They're working, running to the store, running to get errands done. Everybody's in a hurry, but we have to stop and think sometimes about what our kids need and slow things down a little bit, try to come up with some strategies to work around it. I want to talk a little bit, first of all, of why sippy cups and the continued use of sippy cups definitely past 12 months, even 6 to 9 months can be a problem for many children. As babies develop, they start out with an oral musculature that is ready for nursing, ready for bottle feeding. That means the jaw, the lips, and the tongue are doing a motion that we call suckling. They're all moving together. As a child grows and develops, several things need to happen to the oral musculature in order to move towards adult feeding and towards adult speech. If things don't move along in the oral muscles and that oral structure, those problems can show up as feeding problems, speech problems, orthodontia problems down the road. So a baby will go from suckling, where their tongue, their jaw, their lips all move together. They have to learn eventually to do what we call differentiated movement. It's kind of a big long word, but all it means is that one muscle or one group, the jaw in this case, is able to be stable, hold itself stable. The lips are able to move in a smile, round, closed, while the tongue is able to move side to side, front to back, up and down. In other words, they're not all tied together anymore. They can move separately. And that allows for the development of all of the different speech sounds. So if we look at a sippy cup, the reason that a sippy cup hampers that normal development is because it encourages suckling. The child's tongue often comes out and sits underneath the lip of the cup, so we're not getting a good lip closure. If we take a regular cup and mom or dad helps their child take a drink, we're encouraging those lips to go, the child's lips to go around the lip of the cup. That's encouraging increased strength in the lips, lip closure. When we start to get more lip closure, we're also starting to see a more adult-like swallow. We want the lips to close tightly, and we want the tongue to do what we call retracting, which just simply means the tongue, if this is let's just say these are the lips, the tongue, instead of being up here like it is for an up and down suckle, it's going to start to pull backwards into the mouth. If you think about straw drinking, if you put your lips on a straw, you are pulling whatever the drink is up through the straw by holding that straw tightly with your lips, and by pulling back or creating what we call a vacuum by pulling your tongue back. And that's the type of development we want to look for your child. So sippy cups tend to hamper that necessary development of the oral structures. They encourage an immature swallow pattern with decreased lip strength and tongue retraction. And this slows down the development of that differentiated movement that we need for speech. It slows down the development of strength that we need in the cheek muscles, the lip muscles, and the tongue as well. So what can we do instead? Let's talk, well, we already talked a little bit about when an infant's born. So if we're talking, 0 to 3 months, you're gonna see mostly reflexive movements orally with the baby. The tongue, the jaw, the lips mostly move together. The baby's ready, hopefully in ideal cases, are ready to nurse or bottle feed, and you see suckling. The tongue tends to move front to back in a sucking motion. And as far as speech goes, we don't have anything that we would consider speech yet, but we have crying, sighing, vowel sounds, those beginnings of speech. Now, as a child moves from 4 to 6 months, you're going to start to see more voluntary control of the oral muscles. We see reflexes that were there for the baby starting to fade away. And we all love how babies explore the world with their mouths. They're going to be putting anything they can goes to their mouth. So their lips will start to close a little more tightly when they swallow. And with feeding, in some cases between 4 to 6 months, it's usually a time when parents will start experimenting with their child with cup drinking. And that usually involves, maybe you're going to hold their chin a little for them. You're going to be holding the cup. They're not yet ready to do it independently. And feeding starts, we start to add in, oftentimes during this period, smooth purees from a spoon. So we start to see a little bit more control with the suck and the swallow. And we're also going to see something start to change a little bit with the speech at the same time. We're going to start to see some cooing, some gurgling, some laughing, and we'll start to hear some beginning consonants. As those lips start to come together and get a little more strength, we start to see P's, B's, M's, and we'll start to see babies playing with pitch and volume in their voice. That's a time, if you have to set a cup down and walk away, that parents will often use a sippy cup. But whenever you can sit with your child and use an open cup and assist them, you're going to be encouraging and supporting their development towards a more adult, older child, and then adult-like oral structure and speech. So as children move from 7 to 12 months, we start to get tongue movement side to side. They start to get teeth. When we're talking about feeding, things change a little bit. They're more independent. They want to be involved. You'll see them mostly still munching as far as a chew. They'll eat finger foods that are easily digestible. Again, drink from an open cup with adult help, and they can begin to learn to drink with a straw. At that same time, we see changes again in speech. We see what we call repetitive babbling, ba, 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 ma, ma, ma. We see the imitation of different intonation patterns in speech, and usually most children will have their first word or a word approximation by the time that they're 12 months of age. So that's where I would say we want to really look by 12 months. At that point, if sippy cups have been used, it's time to start weaning them, starting to get rid of those, start moving into a cup as much as possible. Because when we're moving from 12 to 18 months of age, jaw stability is increasing. Children are moving from a suckle to a mature swallow with tight lips. We can start to look at more refined cup and straw use, along with minced and chopped foods, since they're getting more control. An open cup with 2 hands or more is typically easy for a child at this age. They'll have less drooling. They're self-feeding with spoons in their hands. They can now take some consecutive swallows without losing liquid from their mouth. And then speech really starts to blossom at this age. Children will have 10 to 20 words, lots of front consonants. Now that goes along with, because they have developed more lip control at this point, and they're starting to get some differentiated tongue movements. So we're starting to not just see p, b, and which all use our lips. Now we're starting to see front consonants that use the tongue, t, d, n. And we'll see kiddos do what we call jargon, which is always fun to listen to. It's like they're carrying on a little conversation. We can't necessarily understand the words, but boy, they've got the rhythm of speech down. Then moving into 18 to 24 months with our toddlers who are walking around, their tongue is able to move independently of the jaw at this point. Their chewing changes. It's not just a munching up and down anymore. It's that rotary circular chewing like an adult. They can hold a cup with one or two hands with minimum spilling at this point. And then they have 50 to 200 words, and they start combining words into phrases. So at this point, if we continue to use sippy cups with our kiddos, you can see that the sippy cup, by encouraging a forward tongue position, poor lip closure, and less of a need to retract the tongue, is encouraging the suckling pattern of our 0 to 6 month old group. It's not encouraging the continued development of that oral musculature like we need for speech. It can be very difficult, like I said, especially if we're on the move. But here's a couple of sippy cups. We've talked about why we might not want to use those. So what else can you use? Open cups, always going to be best. Not always possible when a child is on the move or when you can't be right there to watch them. And there are times you may be at somebody's house, you might be in the car, and it becomes an issue that you just don't want it spilled. In those cases, some people sometimes will recommend more of a cup with a lip. It's called a spill-proof cup. It does have the advantage of getting a little more lip closure possibly than a sippy cup. However, what happens for some children, it's not ideal because some children will, as they try to stop the liquid, they'll either push their tongue into the cup or they'll push with their lips, and then that encourages what we call a tongue thrust, and that's not a great adaptive skill that we want for our kiddos. So possible for small, short times if you absolutely have to have something. Maybe you're on an airplane, in a car. I wouldn't recommend it all the time for sure. And it gets very difficult as a parent. I mean, I walked into a local store and pulled a few things off the shelf just to see what's out there for parents. Straw drinking can be really good. It encourages lip closure, tongue retraction, all those things that we want for the development of the oral musculature and for development of speech sounds. They have something now that they didn't used to, which is kind of neat. They're called weighted straws. That helps because a child can get liquid out whatever angle the cup is at. The problem with a lot of these, unfortunately, is that again, the focus has been placed not on speech and oral development, but on avoiding the mess of spills. So I don't think you're going to be able to see it in the video, but there's a little block there. That little block is so if it falls over, less liquid comes out. If a child has fully developed all of that musculature and their speech sounds are great, a small block may not be that big of a deal. But if a child is still developing and they don't have those skills needed, or they don't have a good lip closure and a good retraction yet, that can make them frustrated. They may bite down on it. And it also, again, may encourage them to put their tongue out underneath that straw. And then that's going to defeat the purpose of why we wanted to use straws in the first place. Here's another example of a weighted straw. You can see there's a weight in the bottom. This one's nice. You could throw it in something because it's got a lid, right? But when we lift it up, again, it's got a barrier in the middle of the straw. I know you probably can't see it. And that's going to make it harder for some children to pull the liquid up through. They might not have the strength yet. That can cause frustration. It could cause them to bite down on the straw, not keeping the oral musculature aligned how we want. and again, not encouraging the skills that we want. Out of all of the straws and cups that I saw at the store, this one had the most potential. I'm going to pull it out here. And most of these, just so you know, most of these say six months and up. One of them I think said 9 months, but looking at this, it's not a weighted straw, so that's the downside. You might have to help a child, but it could be handy when you're teaching straw drinking. It does not have a block in the straw. Actually, I take that back. It does have a block in the straw. It tricked me. The block in the straw is further down. So that's going to be an easy transition to my next recommendation. These all ran, gosh, in probably $5 to $9 range. I'm going to list at the bottom of the video for you. There'll be some links, and we'll show some pictures to some cups that have been designed more to help promote the proper movement of the lips, tongue, and jaw to help develop speech normally. We've got the website talktools.com. They have a honey bear with a straw. They also have another, it looks like a sippy cup, but it's not. It's got a straw and it's got some nice features. We have an easy peasy cup. They have one for younger children and one for older children as you transition from cup drinking to teaching straw drinking. Oftentimes, what I found as a parent, and in talking with parents as I've recommended different types of cups or straw drinking, is that a straw often gives a parent enough time to get to where the cup drops. So if you're worried about spills, a straw is generally going to spill less than an open cup. So that's something to keep in mind. So we've got easy peasy cups, we've got the Talk Tools cups, and then there's one other La La Land weighted straw cup, and that has the weight in the bottom, so it's easy for the child. They're not getting frustrated if they turn the cup the wrong way. But it's also not a blocked straw that is going to encourage the tongue forward motion again. So I hope that what we talked about today encourages you, even though it's a hassle, spills are a hassle, but I hope it encourages you to work with your child on regular cup drinking. Before we had all of the cups to make things easy and less messy, children generally were starting to drink out of an open cup by 6 months of age with a little help by their parents. By 12 months, they were pretty much independently able to drink from an open cup and learning, if not already mastering, straw drinking. So with a little creativity, I think we can continue to do the same today for our kids to help encourage the oral development that they need for good speech and language as they are maturing. Thanks for listening.